diagnosed with breast cancer in November of 2013, and at the time I was 33, and I was devastated when I was diagnosed. I could not believe that at 33 I was dealing with a breast cancer diagnosis. At the time, when I had met with my surgeon, we did not know whether or not we were going to go through with a lumpectomy or a mastectomy, and I chose to do neoadjuvant chemotherapy. So it gave me a little bit of time to decide exactly which surgery I wanted to go forward with. And after finding out that I was positive for the BRCA2 gene, it was inevitable. I had to get a double mastectomy, and it was the best recommendation from my surgeon. So my general surgeon referred me over to PRMA, and I had my first appointment about halfway through my chemotherapy, and I was so scared. I had no idea what to expect. I had no clue, you know, what my options were going to be. I did some research online, and my biggest fear was that I would walk out of my surgery and have 2 scars and nothing there. And I was so relieved to find out after meeting with Dr. Ledoux. I was so happy to find out that I was a good candidate for breast reconstruction with expanders. So I knew that I was going to be walking out of surgery with something there. And that first appointment after I left, I can't even tell you how comfortable I felt with PRMA, with Dr. Ledoux and with his nurse Jenny. They made me feel so comfortable, and I was the patient that did not get a second opinion because I happened to be so comfortable with them that I just chose to go with their recommendation on this type of surgery. So on my surgery day, Dr. Ledoux came in, and I was so scared. I was in the pre-op room, and I was crying and just freaking out about this crazy, insane surgery that I was about to have. And Dr. Ledoux came in and held hands with my entire family, said a prayer with us, and I can't even tell you how much that comforted me in that moment to know that, you know, I was in the best hands possible on that day. And all my fears just were lifted, and Dr. Ledoux's bedside manner was absolutely incredible. After my surgery, when I was in my recovery room, the nurse came in to undo my beautiful white bra that they give you, and I was so scared to look down because I had no idea what was going to be there. And when she undid the bra, you know, she needed to check my incisions to make sure that everything was healing okay, and she undid the bra, and I looked down, and my first words were, "Oh my gosh, I have more cleavage than I've ever had in my life." So it actually made me feel good to, you know, be able to look down and see something there and see cleavage and not be totally flat-chested. So that was my experience with my surgery. Now, as far as, you know, the follow-up process, I have since April 1st was when I had my surgery, and since then I've had 3 fills. And I truly do feel like I am a part of a family here at PRMA. Not only do they care so much for the reconstruction side of everything, but they also offer monthly meetings for breast cancer women, which, you know, there's the whole part of dealing with the emotional side of having a cancer diagnosis, and then you have to deal with the physical side of having a cancer diagnosis. And the fact that they care about the emotional and the physical, and they're there for you through the entire process, is, you can't even put that into words. And the compassion that Dr. Ledoux has shown throughout this entire process has been, I just can't even explain to you how much, you know, what he has done for me, what it means to me, and what the entire staff here does for their patients. I know this sounds crazy, but I actually feel better in a bathing suit now than I've ever felt in my entire life. And that, you know, after going through all of this, to feel that way about my body is just, it's amazing. So I can't thank PRMA enough for everything that they have done for me, and I am so looking forward to my exchange surgery in 1 month and feeling even better in a bathing suit. Thank you so much, PRMA.